Questions for Dr. Farine, please?
I'm quite intrigued by the long-term steroid study. Because I know nothing about pregnancy, but in terms of steroids, there has been, certainly in the CNS literature, there's been this whole issue, the CHARGE study, showing actually worse outcome CNS-wise from long-term steroid exposure following brain injury. There's a talk 2 days from now looking at spinal cord injury and showing that steroids actually worsen injury. So are you planning on doing any neurodevelopmental analysis on the kids?
It's interesting. I mean, the real issue, we would like to do everything. Mm-hmm. The problem is that you have to bring those kids that are 15 to 18, seduce their parents and seduce them to do whatever you want to do. And we decided that we cannot do it in more than 2 days. So we intend to do some blood work, lots of anthropomorphic measurements, blood pressure. We would like to do more, but I'm not sure that we can. If we find significant findings in any of those, we can actually do it later on. The other issue with these kids are that they are 13 to 18. So it's a very problematic age in terms of recruitment.
Although, if they're 13 to 18, they will be in school, so you'll know their school. You could just ask a general question about school performance. And the other issue is for things like ADHD and things, you should have at least. It might be worth just asking a question or two. Just mention.
No, let's make it clear. First of all, we do intend to do a variety of tests to see how they function. So it's going to be IQ, it's going to be school function, and so forth. The real issue is more to what extent you can do actually stimulation and suppression tests on the different hormones, and we are a bit limited there. But if we have positive findings, it will be a very good basis to do it on the long run. If we have negative findings, it's going to be a major issue because I didn't have enough time, but those kids were exposed to mega dose of steroids from the 8th week of pregnancy till birth. And if it's going to be a negative study, you can be assured that steroids in lower dosages for shorter periods, like what we use for lung maturity, which is 1 pulse or 2 pulses or 3 pulses, if we show that this was safe, it's going to be really safe.